The Lupus Initiative is pleased to present Dr. Rosalind Ramsey Goldman, MD, Doctor of Public Health, still of the Arthritis Research Society Research Professor of Medicine at Northwestern University's Feinberg School of Medicine in Chicago, Illinois.
For our topic today on lupus and pregnancy, I'd like to make sure that we go over the following 4 objectives. We'll be identifying fertility preservation strategies, we'll be discussing contraceptive methods, we'll be evaluating pregnancy effect on maternal disease and fetal outcome, and we'll be describing medication use during pregnancy and lactation. In order to frame our talk today, I'm going to present a case to you to give you something to think about while you're going through all of those objectives. And at the end of the talk, I would like you to be able to counsel the woman on those 4 items. So our patient today is a 25-year-old woman of Hispanic descent, and she already has lupus manifested by a malar rash, arthritis, pleurisy, and a positive ANA. She's in your office now because she has new onset renal disease where her renal biopsy confirms diffuse proliferative glomerulonephritis. She has hypertension, and her lupus serologies are very abnormal. You're engaging in a conversation with her about how to treat her lupus disease, and she mentions that she's just engaged and is planning to get married soon. She's worried about how this treatment that I'm talking about is going to affect her kidneys and have them recover, but she also wants to make sure that we still have the option of future pregnancies. Even though today we're not going to be discussing the treatment for lupus pregnancy, we should mention the medications and kinds of things that you're going to be thinking about in terms of treating her lupus, but at the same time you're going to be thinking about maintaining her possibility for future pregnancy. So you're going to be thinking about some lupus-specific medications such as glucocorticoids, immunosuppressive medications such as cyclophosphamide, mycophenolate mofetil, and azathioprine. In addition, you're going to be thinking about some other supportive treatment for her disease, either for the disease itself or to combat some potential complications. You're going to be treating her blood pressure with antihypertensive medications, and this is usually going to include an ACE or an angiotensin-converting enzyme inhibitor or their cousin called ARBs. You're going to be taking care of her bones with calcium and vitamin D, and she may ask you about these new medicines called bisphosphonates and whether that's appropriate for her. These patients sometimes have cholesterol abnormalities, so you might have to talk about giving her a medication for that called a statin. And at the same time, you need to take care of some lifestyle issues concerning diet, weight control, smoking cessation, and exercise. So her first question is, I want to make sure that I still have a baby, so how can you help her think through all of these treatment options so that we can preserve her fertility? I mentioned that for lupus nephritis, we would be giving glucocorticoids and immunosuppressive drugs, and the one drug that might interfere with her fertility and put her at risk for premature ovarian failure is cyclophosphamide. So I'd like to review some potential strategies that you can offer her if that's what you choose to use to treat her renal disease. So for preserving fertility, there is an open label trial looking at ovarian protection, and this was in women who had severe lupus, and they were treated with monthly bolus pulses of cyclophosphamide. In this case, they were offered a gonadotropin-releasing hormone agonist to suppress hormones that would have the patient ovulate. And in this case, they received leuprolide acetate, and they got this medicine every 4 weeks. And in this study, they looked at how many patients then went on to lose their fertility. On this slide, you can see that the patients who received that special medication, and on this slide, it's the top solid line that's got the GnRHA next to it. And if the line is almost straight across, which means that only 1 patient out of 20 lost her fertility if she received this medication. The control group did not elect to take this medication, and as you can see, many more women lost their fertility either at the end of the time that they were treated for the lupus nephritis or several years later when they were attempting pregnancy. So in this open label trial, there was a suggestion that this potential medication might be used in someone who might want to preserve their fertility. And there are ongoing studies to reevaluate this and make sure that this would be a viable option. There are some other choices also. And these would be ones that are relatively newer, and these are called assistive reproductive techniques. And in this case, you can preserve an embryo. And if the woman says, well, how successful is that? That's successful about 25% of the time. So this is an option for a woman who is mature, can ovulate, and has a partner, or would be using a sperm donor, and she could save embryos and use them in the future. There is another experimental technique where they actually remove ovarian tissue and freeze it and then reimplant it after you have your exposure to the potential medication that might cause fertility problems, and in this case, the cyclophosphamide. But this is investigational, and though live births have been reported, it's not clear what the percentage of success would be. But these are three things that you can discuss with the patient and with her partner, and you can decide if any of those are appropriate if the cyclophosphamide medication is chosen. The next item that you would be discussing with this patient is contraception. In a later part of this talk, we'll talk about what happens to women who have active lupus and the effect that might have on a pregnancy. But for right now, let's assume that she does not want to become pregnant, which is what we would advise her, because we'd like her disease to be treated, we'd like everything to heal, and then plan for the pregnancy in the future. When you're discussing contraception, the first areas that you will discuss with her and her partner would be barrier methods. Most of these would not have any adverse effect on the lupus itself, but the disadvantage that they would have to be used on a regular basis. You can't not do that. There's another barrier method that would include some medication in it called an IUD, and those are also acceptable medications. And the one that's listed here has progesterone, and we'll talk about this a little bit later, but that hormone would be acceptable and would be not likely to worsen the lupus after you've worked so hard to treat it and get the kidney disease taken care of. The guidelines for the use of oral contraceptives are particularly important because this is the area that has caused the most controversy and where people would be most concerned about whether or not there might be a problem with worsening the lupus while you're trying to prevent the pregnancy. So when we think about trying to use these medications, we usually want them used in someone who is inactive or stable but moderate disease, not severe disease. The individual cannot have a history of thrombosis, or in this case I'm meaning blood clots, and they can't have blood markers that would indicate that they'd be at risk for having blood clots, and these would be measured by the lupus anticoagulant or high titer antiphospholipid antibodies. We would not want the woman to smoke, and we would want the blood pressure controlled. And if you were going to use an oral contraceptive that included estrogen and progesterone, you would recommend a pill that had the lowest dose of both of those medications, just enough to prevent the pregnancy, which would be the goal here, and not increase any risk of worsening the lupus. There are two studies that actually looked at the safety of using oral contraceptives in lupus, and I'd like to show those to you now.